I'm Mike Torno. I'm from PSI. I'm Director of Marketing and Development here at PSI. And today we're going to be joined by Dr. Carly Wilbur for a medical moment. And let me introduce Carly to you. Dr. Carly Wilbur serves as our medical director. She is a board certified pediatrician with University Hospitals Rainbow Babies and Children's Hospital in Cleveland, Ohio. She graduated from Barnard College, Columbia University in New York City, and earned her MD from Albert Einstein College of Medicine. She returned to her hometown of Cleveland to complete her internship and residency at the Children's Hospital at the Cleveland Clinic, and then joined University Hospital as an attending physician and clinical instructor in 2003. Dr. Wilbur cares for infants, children, adolescents, and young adults at the UH Rainbow's Suburban Pediatrics with offices in Shaker Heights and Solon, Ohio. Welcome, Dr. Wilbur.
Hi, Mike. Thanks for having me.
Today, we're going to talk about COVID contagion in the schools. I prepared a couple questions for you, and I'm hoping you can give us some insight and some answers to some of these questions. So if you're ready, I'll go ahead and get started. Question number one. If a person is wearing a mask while at school and has been exposed, so within 6 feet for 15 minutes or more, to a person in school that has tested positive for COVID-19, do they need to quarantine and or be tested?
Excellent question, and it will come up again and again. According to the American Academy of Pediatrics, in a classroom setting where everyone is properly masked, a safe indoor physical distance is considered 3 feet. Obviously, 6 feet is even more cautious and should be the standard for times that masks are off, like during meal times. Unvaccinated, close contacts of COVID patients do need to quarantine for 14 days from the last exposure, or they can obtain a test on day 5 to 7 after exposure, and if that's negative, they can return to school on day 7. But continue to mask indoors and carefully watch for emergence of any symptoms for a full 14 days. If you're vaccinated and you've become a close contact of COVID, these patients do not need to quarantine. They can test on day 3 to 5 after exposure, and they should continue to mask indoors in public for 14 full days or until the test result is negative.
Yep. All right, so good answer for that one. It helps us a lot. Number two. Should a person quarantine if someone in their household has tested positive for COVID-19?
Another good question. Most families do not wear masks inside the home, so if one person tests positive for COVID, everyone else in the house is, by definition, a close contact. Anyone who is fully vaccinated, that is at least 2 weeks past the second COVID vaccine in a series of 2 shots like Pfizer or Moderna, or the 1-dose COVID vaccine like Johnson & Johnson, does not, according to the CDC, need to quarantine. Unvaccinated individuals, however, who share a home with a COVID positive patient must quarantine for a full 14 days. They can obtain a test on day 5 to 7 after the last close contact, and if it's negative, they can return to school or work on day 7.
All right, good, good. So what symptoms or combination of symptoms should a parent keep a student home for?
COVID symptoms run the gamut. A fever of at least 100 degrees, chills, cough or difficulty breathing, nasal congestion that isn't related to allergies, diarrhea, vomiting, headache, sore throat, fatigue, or loss of smell or taste. If your child is unwell at all, err on the side of being abundantly cautious and keep them home from school and their extracurricular activities.
Well said. All right, another question here. Do students need a doctor's excuse to return to school if sent home with COVID symptoms?
So far, that has been the standard of care. If a teenager complains of fatigue or a headache that's clearly not related to illness, that probably doesn't require any official documentation for return to school. PSI has designed a comprehensive form that a child healthcare professional can sign that indicates whether the child has been diagnosed with COVID, is waiting on a COVID test result, or has been cleared for return either because a different source for the symptoms were identified, or their COVID test was negative, or if the patient's symptoms have resolved.
Appreciate you pointing out that form. If a note is not required, how long should they stay home before returning, like with or without testing?
So anyone who tests negative for COVID with a PCR test can return to school or work once they're fever-free for 24 hours without the help of fever-reducing medications. While a COVID test is pending, patients should quarantine at home just in case it's positive, and their siblings should also stay home for that very same reason. If the doctor felt COVID testing was unnecessary, the child should stay out of school until their symptoms have resolved entirely.
All right, one more question here for you. I'm wondering what the policy or recommendation is for schools for the school year for aerosol meds and also suctioning of like the fragile students.
A good question. Aerosolized medications should still be avoided except in life-threatening situations. Metered dose inhalers, puffers, MDIs, like albuterol, can be safely administered with standard universal precautions. Any student who requires an aerosol for an acute illness that cannot be treated with an inhaler should be sent home. For fully vaccinated students who require routine suctioning, this can be accomplished with the operator using an N95 mask, a face shield, gown, and gloves. Schools may want to routinely screen these children for COVID. Unvaccinated or partially vaccinated children who require routine suctioning might just not be appropriate for school at this time. Emergent suctioning should be performed with full protective gear.
Well, I appreciate the thoroughness of answering all those questions. And I want to thank our audience for joining us for a medical moment with Dr. Carly Wilbur talking about COVID contagion in schools. Thank you, Dr. Wilbur.
Stay safe, everybody.